Hi viewers, welcome to ChemEasy. In this video, let us see the classification of antihypertensive agents. Before watching this video, subscribe ChemEasy to learn chemistry easily. Before going to classification, a small introduction about hypertension. Blood pressure, that is BP, is defined as the product of cardiac output and total peripheral resistance. Vasoconstriction caused by the sympathetic nervous system is the main factor that increases total peripheral resistance. Cardiac output is the product of heart rate and stroke volume, which is determined by three aspects. One is preload, that is the amount of blood being delivered to the heart. Second one is afterload, the force against which cardiac muscle shortens. And the third one is contractility, that is the capacity of the cardiac muscle for becoming shorter in response to a stimulus. Additional factor involved in determining blood pressure are blood viscosity, blood volume, and various nerve controls. BP is expressed as the systolic blood pressure, which measures the pressure during the filling of the heart, over the diastolic pressure reading, which measures the pressure after the heart has emptied. Cardiac output is the major determinant of systolic pressure, while total peripheral resistance largely determines the level of diastolic pressure. The normal blood pressure is 120/80, and we can define hypertension like this. Hypertension is defined as a disease in which the systolic blood pressure is greater than 140 and the diastolic blood pressure is greater than 90. In this table, various stages of blood pressure along with its systolic and diastolic pressure mentioned. For normal, systolic blood pressure will be less than 120 and diastolic will be less than 80. In case of pre-hypertension, systolic will be 120 to 139 and diastolic is between 80 to 89. In case of hypertension, there are four stages. Stage 1 is mild. Under mild conditions, systolic BP will be 142, 159 and diastolic will be 90 to 99. The second stage is moderate. For moderate, systolic is between 160 to 179 and diastolic is 100 to 109. Stage 3 is severe, between 180 to 209 in case of systolic and 110 to 119 for diastolic. And stage 4 is very severe hypertension. In this stage, systolic blood pressure will be greater than 210 and diastolic blood pressure will be greater than 120. So this picture shows the blood vessel during normal and pre-hypertension and hypertension stage. Next, let us see hypertension therapy. Hypertension control begins with detection and continued surveillance. Initial reading of blood pressure should be confirmed with subsequent readings for several weeks unless the pressure is dangerously high at the first reading. Next one is regimens for reducing blood pressure. Here there are various stages. It means various steps. In step 1, modifying lifestyle factors. Under modifying lifestyle factors, high sodium intake is reduced to moderate sodium intake, excess consumption of calories to weight reduction, physical inactivity to regular aerobic physical activity, excess alcohol consumption to moderate alcohol consumption, nicotine usage to cessation of nicotine usage, and high stress to control stress. In regimens, the step 2 is monotherapy. Here, use of a single drug, that is usually diuretic, beta blocker, ACE inhibitor, angiotensin 2 receptor antagonist, or calcium channel blocker. In step 3, Add a diuretic if it was not the drug used to begin therapy in step 2 of the regimen. Then step 4, add third agent that will be synergistic with the other two in reducing blood pressure. Now let us go to our topic antihypertensive agents. Any agent used to reduce blood pressure and its accompanying symptoms are known as antihypertensives. An ideal antihypertensive drug should produce a reduction in blood pressure through generalized vasodilation without side effects or development of tolerance during continuous administration. It must be consistently effective by mouth with a duration of action about 8 hours. BP is only a part of mechanism that controls the perfusion of blood through the various tissues. The elevated blood pressure may cause death through certain deleterious effects like stroke, heart failure, and kidney failure. Classification of antihypertensive agents. First, I'll give you each class with the drug names. After that, all the important structures will be given separately. Under classification of antihypertensive agents, the first class is diuretics. The drugs comes under diuretics includes bumetanide, ethacrynic acid, furosemide, torsemide, epidizide, hydrochlorothiazide, bendroflumethiazide, methyclothiazide, polythiazide, indapamide, chlorthalidone, metolazone, amiloride, triamterene, spironolactone, and eplerenone. The second important class is calcium channel blockers. These calcium channel blockers again subdivided into four category. First one is 1,4-DHP, that is 1,4-dihydropyridines. Drugs under this subclass is nifedipine, felodipine, amlodipine, nicordipine, nimodipine, nizoldipine, nitrendipine, and lercanidipine. Second subclass is phenylalkylamines. Drugs are verapamil and galopamil. Third one is benzothiazepines. Under this, the drug name is diltiazem. And fourth subclass is diaminopropanol ethers. Under this, the drug is bepredil. Third class is ACE inhibitor, that is angiotensin converting enzyme inhibitor. Drugs are captopril, enalapril, fosinopril, lisinopril, moxapril, perindopril, quinapril, ramipril, prandolapril, and benazepril. Fourth class is angiotensin 2 receptor antagonists. Drugs under this category is azilsartan, candesartan, eprosartan, irbesartan, losartan, olmesartan, telmisartan, valsartan, and femosartan. Fifth class is adrenergic receptor antagonists. These adrenergic receptor antagonists again subclassified into beta blockers. Under beta blockers, beta 1 selective drugs are acebutolol, atenolol, bisoprolol, esmolol, and metoprolol. Non-beta 1 selective drugs are timolol, nadolol, and propranolol. Under adrenergic receptor antagonist, the second class is alpha blockers. Drugs under alpha blockers are doxazosine, pentolamine, indoramine, phenoxybenzamine, prazosin, terazosin, and tolazolin. The third subclass is mixed alpha and beta blockers. Drugs are bisindolol, corvedilol, and labetalol. The sixth class under antihypertensive agents are vasodilators. Vasodilators again classified into arterial vasodilators and arterial and venous vasodilators. Arterial vasodilators includes hydralazine, diazoxide, and minoxidil. Under arterial and venous vasodilators, sodium nitroprazide. The seventh class is renin inhibitor. Drug name under this category is aliskiren. Next class is alpha-2 adrenergic receptor agonists. Drugs are clonidine, gonabens, guanfacine, methyl-dopa, moxonidine, and relmenidine. Ninth class is adrenergic neuron blocking agents, reserpine, guanethidine, and guanadrel. Next one is ganglionic blockers. Drugs includes mecamylamine and trimethophan. 11th class is phosphodiesterase inhibitors. Drugs are enamrenone, milrinone, and sildenafil. And the last one, miscellaneous category. Under miscellaneous, praguelin, metyrosine, and bosentan. Now let us learn structures for some of the important drugs under antihypertensive agents. These are the drugs under diuretics. This is the structure of furosemide, hydrochlorothiazide, methyclothiazide, and spironolactone. Second class is calcium channel blockers. Under calcium channel blockers, this is a structure of nifedipine, amlodipine, felodipine, nicardipine, nimodipine, verapamil, diltiazem, and bepredil. Next class is angiotensin converting enzyme inhibitor. This is the structure of captopril, enalapril, lisinopril, ramipril, and perindopril. Fourth category is angiotensin 2 receptor antagonists. Under this category, this is the structure of losartan potassium and this is valsartan. Next class is adrenergic receptor antagonists. Under adrenergic receptor antagonists, the first subclass is beta blockers. Beta 1 selective drugs includes acebutolol, atenolol, bisoprolol, esmolol, and metoprolol. Non-beta 1 selective drugs are timolol, nadolol, and propranolol. Second subclass is alpha blockers. Under alpha blockers, prazosin, tolazolin, and pentolamine. Third subclass is mixed alpha and beta blockers. Under this category, this is the structure of carvedilol and this one is labetalol. Sixth class is vasodilators. Vasodilators includes hydrolysine and sodium nitroprusside. Next class is renin inhibitor. Drug name under this category is aliskiren and this is the structure of aliskiren. Eighth category alpha-2 adrenergic receptor agonists. Drugs under this category is clonidine and methyl-dopa. And the ninth class is adrenergic neuron blocking agents. This is the structure of reserpine under this category and this is the structure of guanethidine. If you like this video, share with your friends and subscribe ChemEasy.